So candidly, it wasn't that big of a surprise when they told me that I had endometriosis. She brought up a sterilization procedure and hysterectomy. As I said earlier in this episode, those are the kind of last resort procedures. Now I have 5 things that I genuinely think are helping me have a smooth and more rapid recovery, and I'm going to share them with you guys. Hello and welcome back to another week of Calling in Sick. I'm your host, Alex Wildeson. I am so happy that February is coming to an end. This was a bizarre, intense clusterfuck of a month. In the month of February, I had 2 rounds of chemotherapy, an endometriosis surgery, and 5 days of IVIG immunotherapy. I am physically, emotionally, spiritually drained and so tired. But there's a lot of great things happening in March, so I'm very excited to just keep on keeping on, continue resting, and get my little booty all the way across the finish line so that I can enjoy all of the awesome things that are ahead. And I have to say, and I'm going to knock on wood, I think some of the treatments are working. So last week I was telling you guys about all of the medical decisions I was needing to make and how I was approaching making those decisions. Well, since then I have made decisions and have had some of these things start to fall into place. And I'm excited to report that I think, fingers crossed, toes crossed, knocking on wood, I think some of this protocol is already working. And honestly, I think part of that is the Rituxan is starting to work. And I also think getting this endometriosis surgery done and having maybe less global inflammation is also really impacting my overall health. So I'm excited to tell you guys all about the endo surgery, the recovery, and the most fucking bizarre post-op appointment I have had to date, and this is coming from someone that has had 10 surgeries. But before we dive in and get into the nuts and bolts of everything, quick little housekeeping. First and foremost, thank you for following, subscribing, liking, and commenting. I love, love, love reading the comments that you guys put on these videos. It makes me smile. It makes my heart happy. I love that you guys open up and share your stories with me. So thank you from the bottom of my heart for doing that. This week, I was wondering if you could help me grow the podcast a little bit. If you don't mind sending this to a friend or posting it on a Facebook group or Reddit page that you're a part of, just helping get this podcast out to more people, I would be super appreciative. And lastly, I would love for you guys to comment below the one thing in regards to your health that you catch yourself minimizing a ton. I'm going to share mine during this episode, and I think we should hold each other accountable so that we stop doing that, because our health is our health is our health, and none of it should be minimized. My Alex picks of the week. If you guys have been following along on social, you definitely have seen me wearing and most likely raving about this Abdominal binder. One of my really, really sweet friends came to Austin for a work trip, stayed with me for a few days. She brought me an Abdominal binder. She had done this research and was like, this is going to be life-changing for you. You need this. I put it on, and it took me from being pretty much bedbound or homebound to being able to walk around on South Congress for like 2 hours on Sunday. So if you have a laparoscopic or abdominal surgery coming up, go check out the Abdominal bands that are out there. They're fabulous. I'm linking in the description below the one that I have. And if you have any questions, obviously put a comment on this and I will help if I can. And my second pick of the week is the Osea and Darien body oil. It is phenomenal. I don't know about y'all, but in Austin, it has been dry as fuck. And all of my infusions definitely are not helping. I get a ton of antihistamines, steroids, all that stuff prior to my chemotherapy and my immunotherapy. And that most certainly just zaps and sucks all of the hydration out of your body. So I've been using this basically daily. Sometimes I dry brush, sometimes I'm exhausted and don't have spoons and say, not today. It smells amazing, but the awesome thing about this brand and company is they also have a fragrance-free option if you're sensitive to smells. I personally love the smell of this oil, but I know at times scents just are not it. So if that is something that resonates with you, go check it out. It's amazing. Link in the description below. So before I can really dive into my actual endometriosis surgery that I had last week, gosh, it's actually bizarre saying I had surgery a week ago and I'm here at home okay. because my last surgery, I was in the hospital for a while afterwards. So before I can really dive into my endometriosis surgery from last week, I should give you guys a little bit of background. Back in 2020, like right before COVID isolation period started, I had appendicitis. And when I had my appendectomy, I woke up and the general surgeons told me, by the way, you have endometriosis. Do with that what you will. I was super lucky that they told me that in the first place. Most people that aren't specialized in endometriosis, I would say maybe, I feel super lucky that they told me that, because I don't think a ton of surgeons are super well trained on endometriosis and the signs to look for. So really grateful that they told me. That's how I found out. There definitely was some suspicion or speculation that I could have endometriosis. I had my first ovarian cyst at age 13 that was massive and almost had to get surgically removed because I was having such bad abdominal pain. I've had really difficult periods, PMS, constipation issues my entire life. So candidly, it wasn't that big of a surprise when they told me that I had endometriosis. However, this was March of 2020, and if y'all have listened to episode 1 of this podcast, you know that was the year that kicked off really aggressive treatments for my vasculitis. So I just took that information, filed it away in the back of my brain and said, I'll deal with that at a later date and time. And that later date and time was April of 2023, I believe. Yeah, April of 2023. And I went and had my first endometriosis excision surgery. I decided both for that surgery and this surgery to go laparoscopic and surgeon, not robot assisted. What that means is that I had 4 little incisions in my abdomen. They use your belly button as the place. They cut your belly button open and they put a camera through there. They blow your belly up with CO2, and that kind of gives the surgeon space to look around and see everything. And then they have like forceps that go in the other holes in your abdomen. It sounds really freaky to me, and I'm so glad I've never seen any videos of laparoscopic surgery. I will never do that because I think I would be traumatized. It sounds terrifying. I chose to not go robot assisted. I don't know why. I just didn't want to. I don't really have a strong positioning on why I didn't, but I know some people do. The jury seems to still kind of be out on how beneficial that is relative to a normal laparoscopic surgery. I think like the recurrence rate I've heard could be slightly higher. But do your own research, because honestly, I'm pretty sure I learned that on Instagram, and that is not Bible, however much I sometimes wish it was. So, and for some knowledge dropping, and because I didn't know all of this before my surgeries, I'll share. So there are basically 5 different types of surgeries that you can pursue for endometriosis. The first one is what I did, laparoscopic excision surgery. I did a laparoscopic excision surgery. That's kind of known as the gold standard. That means that the endometriosis is getting cut out, not burned. That's called a laparoscopic ablation surgery or coagulation surgery. There is a higher risk of recurrence if you do the ablation surgery. The excision surgery, if it's done to completion, means that there should not be reoccurrence of endometriosis in the spots that have been operated on. Granted, there's certain things in certain parts of your abdomen that can't be excised and have to be ablated. Ablated? Sure, we'll go with that. And ablation basically means cauterizing or like burning whatever that endometriosis spot is. The second type is the robotic assisted laparoscopic surgery. That's more frequently used for like really deep endometriosis. That's typically used for really deep infiltrating endometriosis. DIE is the acronym for that, on the bowel or the bladder. My imaging did not show that. Because my endometriosis was rather superficial and not very deep, imaging didn't even pick up my endometriosis. However, if you have that deep endometriosis, it most likely will show up on a scan. Not always, but it's more likely to. The third kind is just open surgery. I think it's called a laparotomy, but don't quote me on that one. That's when you have like the full cut in your belly. It could be vertical, could be horizontal. I don't know. but those are the two options, so it's going to be one of them. And that's for really, really severe, deep cases of endo where there's organ involvement typically. It is a much, much longer recovery time if you have a full open surgery. The next one is a hysterectomy, and that's kind of seen as the last resort. And it also does not guarantee being totally free of endometriosis because endometriosis can grow elsewhere, as we know. And the last type of surgery is the most severe, and it's called a resection. And that's usually when you have like bowel or bladder or something else involved where other specialist surgeons are going to be tapping into your surgery to assist in the total removal and excision of that endometriosis or partial or full removal of different parts of your organ systems. That one is fucking intense, and I feel very lucky that I had a laparoscopic excision surgery, which is I think out of all the surgery options for endometriosis, the least invasive and hopefully the easiest to recover from. So I decided to have my endometriosis excision surgery in 2023 because Cooper and I were thinking of family planning right around that corner. And I wanted to have the best fertility foundation possible. And I knew I needed to have that endo removed to unlock the most pristine conception space for my future babies. So I went forward and I did it, and I recovered from that surgery in 11 days. It was relatively fast and easy for me. I utilized a lot of different tools that I'll get into later on, but my health also foundationally was at a really good spot at that time. I'd been doing all this I'd been really combining Western and functional medicine. I was starting to be able to actually come off of some of my Western medicines, kind of lighten the touch on some of the functional treatments I'd been pursuing, and I was feeling pretty good. So baseline going into that surgery looked a lot different than baseline going into the surgery this time. I chose to not go on hormonal birth control after my first surgery because we were thinking of family planning. I chose not to go on hormonal birth control after my first surgery and after my second surgery for two really specific reasons. The first one was family planning. I want my cycle to be naturally regulating when we're going towards conception. That was important to me. The second and probably most important reason, though, is that hormonal birth control, especially estrogen-heavy birth control, impacts lupus and vasculitis in my cases. So when I have been on hormonal birth control in the past, I have gotten incredibly awful flare-ups. And honestly, coming off of birth control, I felt significantly better. So when I was weighing the options, having flare-ups, potentially getting towards organ involvement, or having to go under anesthesia and the knife, maybe more than the average Joe, I chose going under the knife and under anesthesia more often. And that was a personal decision. It's not for everyone. And as you guys will hear later, not every specialist is going to agree with that opinion. But that's what worked for me. That's what Cooper and I had decided on, and I stand by those decisions. One thing that I found really challenging with endometriosis is that there are so many different opinions from really, really well-trained specialists on why endometriosis happens, why it grows back, what actually is the gold standard of care, and, is birth control, hysterectomies, is that the only thing that's on the table for controlling endometriosis? I don't want to talk out of my ass and pretend like I know all of the answers to this, so I'm not going to. So if you do know the answers to some of these things, please send them my way. Okay, and that kind of takes us to so I had that surgery in 2023, was doing fine, had that spinal injury, surgical injury, that kind of kicked off a shit ton of inflammation in my body, sent my autoimmune stuff into a heyday. And I know that all of that stress and heightened cortisol and everything impacted my reproductive organs because my period started going out of sync and wild, which it never has. I've been very regular my entire life. I think that probably is why I started having endometriosis recurrence again. Granted, I also, as I just said, was not on birth control. So fast forward to August 2024, and I found a lump on the right side of my abdomen. And basically the week prior to my period and during my period, I would get really, really intense pain right there. And then it would taper off as my period ended and was quiet for 2 weeks. So it was this very cyclical pain. I was hospitalized for it in August. Scans weren't showing anything besides inflammation right there. I saw my gastroenterologist. She said, this sounds like endometriosis. I saw my rheumatologist. She also agreed. And then I finally went and saw my OB, and then I finally went and saw my endometriosis surgeon. She was a little hesitant at first about doing anything. At first, we were just going to biopsy this little spot. But then upon reflection, I said, I think I actually want to go forward with a second laparoscopic surgery. Cooper and I really want to start a family in the next 2 years. I'm going through all of this really intense autoimmune treatment right now that should be suppressing everything. And I said, can we just clean it up? And maybe that wasn't the right words to use because she definitely remembered that I said that phrase. I just meant more like, I'm in pain again. I don't feel very well. This is becoming a problem again and I need help and I want it taken out. But there was definitely some friction. So maybe that was the first beige flag that maybe this provider wasn't going to be the right provider for future endometriosis help. During that appointment in October too, you guys might recall I talked about it on my Instagram. She brought up a sterilization procedure and hysterectomy. As I said earlier in this episode, those are the kind of last resort procedures. Knowing that I wanted to have children, those shouldn't have really been brought up in this appointment, I don't believe. I think a provider who knows me, knows my story, and wants to work with me, they are committed to helping me try to get my health into the best place possible so that I could potentially carry a child in the future. So looking back, that definitely was a beige flag, but I was so medically fatigued from this last year of the spinal stuff and the autoimmune flare-ups again. I just kind of let it fly. And I said, okay, let's just get to the surgery and get it done and keep on keeping on. I didn't see her again until literally the day of my surgery, which also was a little funny that we didn't touch base beforehand at all. So I went from October to February without hearing from her. So that brings us to last Monday when I had my endometriosis surgery. There's all these instructions that you need to follow in regards to medicines that you start and stop taking, the HibiCleanse antibacterial wash that you have to use 2 or 3 times prior to even arriving to the OR and leaving it on your skin for a certain amount of time. My favorite instruction, clean sheets. You have to put clean sheets on your bed. I'm a clean sheets on Sunday kind of girly, so any time where I can have extra clean sheets in a week, I'm so happy. You also have to go NPO, no food or liquids at certain hours prior to your surgery. There's just a lot of instructions. So I'll definitely make a reel on socials that go through all of them so that you guys can feel super prepared when you go into any of your upcoming surgeries. So at 11 a.m. on Monday, Cooper and I get to the hospital. My surgery is scheduled for 1 p.m. We get pulled back pretty quickly. They have a goodie bag for you as if you're at a kid's birthday party. In that goodie bag is a very, very sexy surgical gown, a hairnet, the amazing grippy hospital socks that we all know and love so dearly, and heated antibacterial wipes. I was very excited about those because they're perfectly warmed and it feels like you're taking a bath, but it's a spit bath. So it's literally a chronic illness girly's dream cleaning scenario. Heated wipes. Love it. Can we do that for at home too? So I do the wipes, I put on the sexy surgical gown, and then I'm chilled to the bone because those wipes were so warm and the pre-op area is so fucking cold, and that surgical gown it's pretty sheer. It is pretty sheer. It's basically just paper, in my opinion. So I lay down on the bed, and then I found the best invention in the world. I think it's called the Bear Hug or the Bearable, but it's this it kind of looks, what's it look like? Kind of looks like that vacuum extender part that you do, that you can, it kind of looks like, do you remember the vacuums in the 90s that had that one part you would unclip and it was like a tube and you would put different tops on the tube to suction stuff out of the corners or in hard to reach areas? Kind of looked like that. And it plugged into my hospital gown, and then it blew warm air into the gown and kind of inflated it. It was amazing until it was too hot, and I started getting beads of sweat that were pooling in my belly button, And then I got quite anxious about if that was going to, if that was going to break the sterile space that we had just created on my abdomen, and was I going to have to clean it all up again? Thankfully, Cooper, sweet St. Cooper, is a man of logic, and he just told me, why don't you just pat it and then turn the heat down a little bit? Mr. Solution Man, so amazing. So I did that, and then I was fine. My surgery got pushed back 2 hours. As it does in the OR, cases tend to bleed over. It happens all the time. I too was one of those patients whose case bled over. So I try to never get cranky about that, because you just never know when you too will be the patient that pushes everybody else's day behind. Next was rounds by all the doctors, the anesthesiologist team, the nurses, my surgeon. We go through what's about to happen. We mark on my abdomen where my lump is. The highlight of that whole time period was the anesthesiologist. He held my hand. He talked to me kindly. He saw that I was anxious as fuck, and he told me, don't worry, honey, I'm going to bring you some good stuff that's going to make you calm. We had some banter about Versed and this makeup and skincare brand that I love, Versed, and how, after he gave me this medication, I believe it was Versed, I tried to tell him about my favorite makeup and skincare brand, Versed, and I have no idea why I did that, but I did. And I don't think he laughed, but I can't really remember. And then we went into the OR. But the OR was even colder, but I don't remember that much of it because an oxygen mask went on my face and then I was out like a light. And I woke up in post-op, and the first thing I realized in post-op was that I was not wearing my sexy surgical gown anymore. I was wearing a hospital gown, which meant at some point I had been totally nude and had been changed. Also was wearing hospital underwear with a pad in them because you do bleed after the surgery. And oh my God, the hospital underwear is fucking amazing. I ordered more on Amazon because I am obsessed. It's so comfortable. It does not hurt your incision sites at all. It's like this gauzy material. I'm a huge fan. Huge fan. If you need a link to go get them, send your girl a comment or a DM. I will send you the exact link. And the second thing I remember is Cooper coming into the post-op area and me being very out of pocket and a little out of character because I was very verbally gushy and a little PDA, and told him, I'm so glad that you're my husband. You're so cute, which is adorable and precious. But that does not sound like something I would say in front of a bunch of nurses and surgeons. Apparently, Alex under anesthesia is very loving and very tender and soft. I think Cooper probably loved it. Not that I'm not tender and soft usually, but I'm just more reserved, I would say, publicly. And then, as you guys know, we were in the post-op recovery area for like 3 hours because I needed better pain coverage, and unfortunately I kept falling asleep every single time they gave me pain medication. When we got home, Cooper got me into bed, got me some bone broth because I hadn't eaten in over 24 hours. And the 10 seconds that he stepped away from me to go to the bathroom, I poured that bone broth completely down my front because I had fallen asleep holding it. I was out of it. Now, and I'm so glad I was out of it because that week was a little rough on the pain. I would say the first 24 hours are typically okay after surgery. You usually have some kind of surgical block, which helps with pain coverage. Usually your body still has some bit of anesthetic and pain medication in the system. So you can't gauge actually like how much pain you're in or going to be in. It's wonderful. I also was highly regimented about staying on top of my pain medication, alternating between acetaminophen, ibuprofen, and the narcotics they prescribed to me for post-op. And because I'm autoimmune, I also had a steroid stress dose. That's when they give you a very high dosage of steroids for 24 hours following your surgery to try to smash any extra inflammation that might occur because of the stress of the surgery on your body. I think it worked. I think it helped. It did make me hyper cranky and very emotional midway through the week when it was getting out of my body. We love that. Thank you, prednisone, for just being the center stage main character all the time. So fucking rude. Because I was taking all of these medications on schedule, I was pretty nauseous and didn't have much of an appetite. So I was taking Zofran, drinking a lot of smoothies, having a lot of bone broth and soups, and basically was kind of on a liquid diet for a few days until I got to the point where I could Have apples in peanut butter. Crazy. Have apples in soybean butter. I use Wow butter because I'm allergic to peanuts. I love Wow butter. It's amazing, high protein, super good. And then I just drank a ton of water and electrolytes. And that was kind of the diet that I stuck to for that whole week. And of course, Olipop's. Anytime that I did eat something that was kind of inflammatory, I felt really bad because it would make my stomach bloat, which was already obviously in pain from surgery. And, I can't believe I haven't mentioned this yet. And the CO2 that they pump your belly up with, well, it has to be released. So you are burping and tooting nonstop. And if you don't, then it travels upwards, the gas does, into your shoulder, and you get awful shoulder pain. So the Olipop carbonated things were helpful, but if I had sugar or gluten or dairy, it was like my worst endo pain, candidly. It was awful. So word to the wise, post-surgery, try to eat anti-inflammatory. Of course, you can roll those dice and see what that looks like for you, but if you want to use my experience as a go-by, don't do it. And I stayed on that kind of schedule of diet and pain coverage for 5 days. The first 2 days, like I said, not too bad. I think it's because there was still stuff in my system. It was day 3 that I started to be like, I don't feel very good. That's when all of those meds have started to wear off. I was getting a little bit lax on my pain dosing schedule, on my pain medication schedule. I was eating peanut butter. I was trying to expand my diet a little bit on day 3. I had walked around a little bit more on day 2. So day 3 was painful. Day 4 was really painful for me as well. But then I chilled and I tried to slow down, rest, eat good again, get back on a really regimented pain schedule. And by day 5, I actually was feeling quite a bit better. And that's when I started also using the abdominal binder. And then I started feeling a lot better. I would say day 6, I was up and walking around. Day 7, kind of back to normal, which is wild to say. Yes, I am still uncomfortable, but I wouldn't say I'm in a ton of pain. However, my normal medication protocol has steroids, has anti-inflammatory pain medications, has immunosuppressants. So I do think that my baseline, I do think tapering off everything to just my baseline doses of everything. So I do think tapering off all of the extra medications from surgery to my baseline normal medication schedule, I probably still have more coverage than the average Jane or Joe. When I've talked to my friends that, I'm just going to say just have, but it's not just have, that also have endometriosis but don't have other autoimmune or chronic illness isms, and they went off of the post-op medicines to nothing, I think their recovery and perception of recovery was candidly harder because they didn't have any coverage from any direction, whereas I do. So I definitely want to wave arms on that one, that I am weird, that I am okay by day 7. You guys also know that I have a really wackadoo pain perception of pain. From the 10 surgeries I have had to date, I have force ranked all of them from easiest to recover from to hardest to recover from, endo somewhere in the middle. It's not the easiest one that I've ever had, but it's most certainly not the hardest one that I've ever had either. But that's my own personal experience and perception of everything. So I always like to say that everyone in the world has their own tsunamis of life crises. And if it's a pain and health crises, that tsunami is going to be your 10. And it might not be someone else's 10, but candidly, that doesn't even fucking matter, because all that matters is your experience with that pain or that health crises or that trauma and getting yourself to a place that's comfortable. The relative experience here does not matter. All that matters is the absolute and individual experience. So I know you guys are hearing me say it took me 7 days and I'm walking around and, kind of back to normal life, but that's because I have a different tsunami history. But that's because I have a different tsunami history, if we're going to keep this awful analogy going on. I have a different tsunami history than everyone else. We each have our own. And I will say that there is a massive drawback to how I am describing this right now. Because endometriosis isn't falling on a 10 for me. That's my spine surgeries, hands down. I tend to minimize some of the pain or experiences that I go through because I'm comparing everything to this really awful experience that I had. That was my 10. And that relative comparison is not just the thief of joy, but also the thief of reality. I recognize that it is fucked up that I was calling my endometriosis surgery a small procedure. Yes, it has small incisions, but the incision size does not always indicate the degree of trauma the procedure was and how much pain you're going to experience from it. This was not a small surgery. This was a large surgery. And I needed to hear it from my primary care doctor, from my dermatologist, from my rheumatologist, from my infusion nurses, and from my family, and from y'all. Had I let myself continue to live in this la-la land of this endometriosis surgery was just small, keep going, I think I would have gaslit myself into pushing too hard, getting back into real life too fast, doing too much movement, and probably would have set myself back. Thankfully, I had people that were checking me. Thankfully, I had people that were not just checking in on me, but also checking me and saying, that's too much. You can't go 0 to 100 like this. You just had a major surgery. And I know this is something I need to work on and work through. I think before I can do that, though, I have to process my stage 10 tsunami a little bit more, and I am not ready to do that yet at all. So for now, I rely on my people to hold me accountable so that I can recover safely and well and be able to reintegrate into normal life when my body is ready. It also helps that I had IVIG this week, which is forcing me to rest. Otherwise, I definitely would have just jumped right back into work and kept going and probably gotten myself into a tizzy. So all things considered, I expect to have a full recovery by day 21. Right now we're at day 7, 8, 9, 10. I'm feeling pretty good, but I know I can't do everything yet. And that's okay, I would say. Now I have 5 things that I genuinely think are helping me have a smooth and more rapid recovery. And I'm going to share them with you guys. So these are the abdominal binder I cannot stop talking about, obviously. Getting a solid poop regimen going. If you do not poop, you are only going to get yourself into a worse position. The bloating will be awful. It will press against areas that were just cut or burnt. That is not a good time. Get on a schedule that works for you. If you need to be aggressive, you need to be aggressive. You know your girl had to be aggressive. I was doing Miralax, Ducalax, Senna, suppositories, all the 9 yards, and I just stuck on it until I went. And it wasn't a good time, and it made my tummy hurt really, really bad. But you have to do what you have to do. Number 3, 4, and 5, you need to check with your doctor first to see if you can do these things. Oh, wait, no. Number 3, PEMF mat by higher dose in a heating pad. I have been laying on my PEMF mat nonstop. I know it's helping me with recovery, and I've had my heating pad on my tummy. My 4th thing is the infrared light box. My 4th thing is my infrared light box. I just sit in front of it. It helps those areas recover way faster. You can also go to wellness clinics and they have infrared beds you can lay in, and that's really nice too. I did that after my spine surgery. Now, number 5 is something that you need to check with your doctors because they are supplements. The first one is SPM Active. It is like a hyper concentrated fish oil without the crap in it. And what that does is, and why I love this supplement is because it doesn't just suppress inflammation, but it stops inflammation. But it actually promotes like the resolution of inflammation because it's going at the start of the train and stopping it. And a close cousin to SPM Active is vitamin E capsules. This is when your incisions are closed and healed. You can poke a hole in them and rub them directly onto your scars, and it helps your scars heal much, much faster because it reduces oxidative stress, which helps prevent scarring. So those scars will be lighter, they'll be lighter and smaller. It's more of a cosmetic thing, but it is helpful and it's great. So let's dive into my post-op appointment from hell because holy shit, this is a bad one. The first orange flag of the post-op appointment is that it was scheduled for 4 days after my surgery. There is nothing that you can do 4 days after your surgery for a post-op appointment. Your incisions are still covered by steri strips. You're still in some pain. You're not at a recovered spot that can be assessed quite yet. So it was far too early. The second beige orange flag was that I got a call at 10 a.m. for my 4 p.m. appointment from their front desk saying, hey, the parking garage is really full. Can we make this a virtual appointment? I was so taken aback that I just said yes. And immediately after I hung up the phone, I thought, why the hell would a surgeon not want to have an in-person post-op? Aren't they going to want to physically put their eyes on me? Especially because I am a high-risk surgical candidate. I have a port. I'm autoimmune. I've got a very suppressed immune system. I would think that they would want to just get their eyes on me and make sure there's no infections going on. It was bizarre. Third beige flag was I got a call at then noon saying, hey, can you get on the Zoom in 5 minutes? Again, taken aback, out of left field, I just said okay, hung up the phone and was immediately, shit, Cooper has a meeting, he can't join me for this appointment now. And that was my biggest mistake I made with my post-op appointment because I was still taking my pain meds, I was a little groggy, I wasn't going to be my best version of me to advocate for myself in this appointment. And I totally could have leaned on him, but I kind of shot myself in the foot on this one, unfortunately, and we had to just roll with the cards that we had. I get on the Zoom, I'm in my bed, and the first thing my provider says to me is, why are you in bed? Not how are you feeling, how are you doing, but why are you in bed? Maybe the intention was to ask how I'm feeling, and it just came across weird, but it came across, and she didn't intend for it to come across in an aggressive way, but it came across in a way that she was judging me for not being healed enough that I would be out of my bed at this point. So as you can tell, the entire appointment started off on a really weird foot. She then asked me if Cooper had done a good job of explaining what had happened during the surgery to me. I said, yes, but I want to hear it from you. Then we spent the rest of the appointment with me holding up my surgical pictures and her walking me through each one. I don't know why it was not pulled up in Zoom. And what that caused was me leading the discussion instead of her. And that was frustrating because I didn't know. Because when you're the patient and you don't know what happened during your surgery, how the hell would you know what questions to ask? I had written down some questions, but looking back, I just wish that this appointment had gone so differently for so many reasons. I know I asked her how aggressive she thought my endometriosis growth or reoccurrence was. I asked how many spots there were, what that meant in terms of grading or level of endometriosis. Her thoughts on what kind of recovery I should expect, both from a pain and duration standpoint. Her thoughts on why this happened so much and so fast in 2 years. Her thoughts on why there was a cyst. Her thoughts on, is that cyst the reason I was having this pain this last 6 months? Her thoughts on, will this help my constipation issues? And every single question I asked, I got a kind of snarky response. The constipation issue was, no, it's because of the medications you take. I don't need to be judged for what medications I take so that I can have a semblance of a normal life. Thank you very much. Her response to why did this happen so quickly and so aggressively within 2 years was, well, you refuse birth control, you've refused a sterilization, and you've refused a hysterectomy, so there's nothing that's blocking the growth of endometriosis. And candidly, taking a step back, everything she's saying, it's not wrong, but it's also not totally right, and the bedside manner and delivery is piss poor. And all of those orange flags would have been one thing, but then she dropped this bomb. Unprompted, my provider goes, and by the way, you're going to need to find a new provider because I'm not going to operate on you again. You are denying birth control. You are denying being sterilized. You are denying a hysterectomy. And I don't believe in operating several times. You're a high risk patient, and I'm not going to do that. So you're going to need to find a new provider. Also, I've only operated on patients more than once, a handful of times, and you're one of 2 that have had endometriosis reoccurrence and regrowth. So that's just not something I do. The other rationale my surgeon had about me needing to see another provider is that they have never seen signs of endo from any form of scans in my entire workup of endometriosis. However, that is because I have what's called superficial endometriosis. It's kind of like it grows everywhere, but it doesn't grow deep. So I'm lucky in that standpoint that I'm not having to like look at bowel resections or something like that, but I'm unlucky in the point that like it still grows everywhere and it is still painful. The staging of endometriosis, I also will wave arms that the staging of endometriosis is not indicative to the level of pain that you experience. You could have endometriosis stage 1 and have the most severe pain possible. I'm talking pulled over, rolled up in a little ball, in pain, throwing up, probably experiencing the god-awful lightning crotch. You know, like when you get that pain cramp that goes like straight to your butthole and it's debilitating and knocks the fucking wind out of you. Awful. Anyway, you could have that at stage 1 and you could have nothing at stage 4. There's no rhyme or reason to it. Apparently the staging is more so surgeons can communicate to each other like how intense or invasive the surgery might need to be. I also think it would just be so nice if we had a patient staging one so that you could have some validation of like the symptoms and experience that you've been having. Especially for the people like me who don't have signs of endometriosis on scans and will sit there thinking, either this is literally in my fucking head, something else is going wrong that we just literally don't know what it possibly could be, or this has to be endometriosis. Living in that gray zone for so long, going into surgery knowing I might wake up and my surgeon's going to think that I'm just full of shit and crazy is such an awful experience to sit with. So I really think that maybe we should band together and make some new kind of labeling for endometriosis that's patient-facing. Good Lord, the mental gymnastics that we have to do as chronic illness patients is mind-boggling to me time and time again. I was so stunned how she was shaming me for the decisions I was making about my body. I also was incredibly frustrated because it became very, very clear that she did not review my past surgical notes or any of our appointment notes. Because had she done that, she would have recognized that I refused birth control under medical guidance. That I had other specialists say, I don't think that's right for your body. I don't think you should be on it. That Cooper and I had had a discussion about how we wanted to start a family. That was the second reason why I was getting this surgery. Why would I want to be sterilized? If I got sterilized or had a hysterectomy, that goal and that dream would be taken off the table. When I asked her questions about, how does this compare to my last surgery, she even admitted that she'd have to go look at the last surgical notes because she didn't remember. Everything was just so jarring about this appointment, from the lack of professionalism to the piss poor bedside manner to the very blatant shaming of how I manage my health and my body. I had tears in my eyes, very vivid, very obviously. And by the end of that appointment, she kind of stepped back and said, now I don't want you to avoid me. If anything goes on, I know you're having some bleeding and passing some clots. Just reach out if you think that they're getting worse. And, if you think you're hemorrhaging, go to the emergency room. Why she thought that would kind of like smooth things over, I have no idea. Because then she asked me, do you want to schedule another follow-up appointment since this was so close to your surgery? And I said, no, I think this has been sufficient. Thank you. And that was the end of that. Burst into tears, told Cooper, and you guys know I'm a verbal processor, so I had to talk to like 5 or 6 other people about this experience to get to a place where I knew she was in the wrong there, not me, that was a bad experience, black and white. I do not regret having a second surgery. I'm very happy that I did. And I made that decision with a lot of thought and a lot of discussion and input from my family, from Cooper, from my family, and from other providers. I also know that God works, or if you're not religious, the universe works in mysterious ways. And doors close so new doors can open. I would not want her to operate on me again. That's for damn sure. And since that appointment, I have learned so much more about endometriosis. It's shocking, part of me is like, man, I really wish I had learned about all of this before my surgery. Maybe I would have gone with a different surgeon for my second surgery. But everything happens for a reason. Now I know that multiple surgeries is not uncommon for endometriosis. In fact, a lot of people have 4, 5, or 6 surgeries until they get to the point of wanting to have a hysterectomy. That hormonal birth control only suppresses endometriosis growing in certain parts of your body. That a sterilization or that sterilization and hysterectomy procedures don't guarantee that you're going to be pain-free and free of endometriosis for your whole entire life. There's a ton more research and studies coming out about all of this and what actually is the gold standard of care for endometriosis. Because that's up for debate so much, it's important to figure out, it's so critical, I realize, to do some research on endometriosis, talk to several different providers with different viewpoints and thoughts so that you can make a really informed decision for yourself. I'm sure it's shocking to some people that, I've been sick for 25 years. You'd probably think that every decision I make is backed up with tons of research, tons of appointments, tons of discussions. And candidly, that isn't true for every decision I make. Sometimes decisions are made because I knew the outcome of that surgery would open up the door potentially and most likely to the goals that I had going into the surgery. Did I do a ton of research on my provider? Yeah, I did the first time, but I didn't re-research her the second time. And candidly, because I'm so medically burnt out, I didn't look around to see if there was a better surgeon to do this procedure for the second time. I just thought that the person who did my first surgery did a pretty excellent job, or so I thought, and that was good enough for me. So let me be your example that even when you are so medically burnt out, don't be flippant about your decisions. And instead, maybe turn to our amazing group chat on Instagram. There's some really stellar researchers in that group. Ask them some questions, ask them for suggestions, and I think you'll be pointed in a direction that's more vetted than maybe you have the energy to do for yourself. And that's what a really good community is for. It's to help unburden the weight of making decisions, I think. And when I think about why I created the group chat and I'm really doing this podcast, it's because I want people to be able to make decisions without the entire burden of having to do all of the legwork and research that is needed and necessary to make those decisions. Meaning you can lean on people that have already done that research and can give you that secondhand. Or maybe there's people that have vetted all of the surgeons or providers in your area and have suggestions on who they think the best could be. And I'm so thankful that that is exactly what this community has turned into. It is amazing to open up my phone, look on that group chat, and see everyone helping each other out. And I don't think I would have gotten through this last week, and especially would not have gotten through that awful post-op appointment if I hadn't had you guys. You guys picked me up when I was down. You didn't let me beat myself up about working with a provider like that. Y'all helped me research new providers in my area. You gave me new tips for recovery and feeling better. And I am incredibly grateful for each and every one of you. So thank you for making my recovery a little bit easier, making the pain of that fucking awful post-op a little bit lighter, and bringing me a lot of smiles, joy, comfort this last week. I freaking love you guys. And thank you for calling in sick with me again this week. I can't wait to catch up more next week. Happy Monday. And that's a wrap. Thank you so much for joining me for another week of Calling in Sick. As a reminder, I would love for y'all to like, follow, subscribe, save, share with your friend, do all of the things. It truly helps grow this community, and it helps these episodes reach the people that need them the most, whether that's for an educational piece, to have a little laugh, or to not feel so alone. As a reminder, Calling in Sick sits on YouTube, Apple, and Spotify, and anywhere else where you can find your listens. From the bottom of my heart, I absolutely love you guys. Thank you so much for calling in sick with me every Monday. It's been an honor and a pleasure so far, and I can't wait to continue building this community with y'all. Love you.